Hello and welcome to the Dr. Tebz show. This is a medical show where we are putting your health back into your hands. And this is a medical show where we're discussing relevant medical topics and different medical issues. And to do this, we are having highly skilled and experienced medical experts. And today, we'll be discussing diabetic retinopathy. And to do this, I have Dr. Aubrey Makgotloe. He is the head of Department of Ophthalmology at the University of Wits. Hi and welcome, Dr. Makgotloe.
Hi, Dr. Tebz, and thank you for inviting me to the show, and hi to the listeners out there at home.
Thank you so much. You know, there's a study that was quoted in the Journal of Ophthalmology now in May 2021. And I mean, they quoted huge numbers. They were saying there's about 160 million people who've got diabetic retinopathy. And of this, 28 million of them have got sight-threatening diabetic retinopathy, and they actually predict that in 2045 that number will increase from 103 million to 160 million. Imagine. And then not only that, the sight-threatening diabetic retinopathy will go from 22 million to 44 million, and majority of these people are in Africa and in other countries such as Asia, but Africa will bear the brunt of this. So this topic is very relevant to our context here in South Africa. So let's start from the very beginning. What is diabetic retinopathy?
Dr. Tebz, diabetic retinopathy is, just before I explain that, perhaps maybe I should explain the eye, how it works.
Definitely.
The eye looks like a ball, it's nice and round, but right inside the eye at the back, there's a structure called the retina, and I think you've got a beautiful picture of the retina here on your screen. This lies at the back of the eye, right inside, and the main function of the retina is to see. So I normally say to my patients that the retina is like a film in a camera. So if you're to remove a film from a camera, the camera really becomes useless. It cannot take pictures. The retina is similar. The retina is exactly what gives us vision, and it's right at the back. And you can see beautifully in that picture, it has got this, what we call veins and arteries, whose main function is to supply the retina with blood. So diabetes affects these blood vessels. It makes them weak and they start leaking. They start leaking blood, fluid, and sometimes lipid. And as a result of that is that the retina at the back stops working nicely. That is called diabetic retinopathy. So diabetic retinopathy, which is what you're talking about, is when the retina caused by diabetes starts working nicely as a result of these blood vessels not supplying it with blood, and largely because the blood vessels are weakened by diabetes. And that happens over time. It takes a long, long time for diabetes to do that. But it's during that time that the vessels or the veins or arteries starts getting weaker and weaker and weaker. And until they get to a point where they no longer supply this very important structure called the retina with blood and food and oxygen, all of which come through these blood vessels. That is called diabetic retinopathy.
Okay, and is this a serious condition?
It is a very serious condition,
okay,
especially from the vision point of view, because if it is not sorted out early, the person can end up blind, and irreversibly so.
Okay.
It is manageable,
yes,
but if it is not sorted out early,
yes,
the person can end up blind from this condition. So it's a very serious condition. And unlike many other parts of the eye that can be replaced, like for example, a lens inside the eye which can become what you call a cataract over them, you can just replace it and put in a new artificial lens. Or the cornea, which is the front part of the eye, we call it the window of the eye. If that was to be diseased to a point where it no longer functions, we can remove it and put the new one. We call that corneal transplant from the person who would have donated the cornea. The retina is completely different, because if the retina gets to a point where it no longer functions, there's nothing we can do. And we normally would say to the person, you're blind, and that's and I'm sure you, like viewers at home, would be aware of somebody somewhere who has been blinded by diabetes to a point where they normally would say that there's nothing that can happen, and they're essentially blinded for life. So it is a very, very important condition, and that has to be managed well and early.
Okay, so if you have diabetic retinopathy, is it equal to say you are blind?
No. If you've got diabetic retinopathy, it doesn't mean that you're blind, but if we do nothing, then you can end up blind from diabetic retinopathy.
Okay.
Because diabetic retinopathy come in stages. So a person normally would start with diabetes, over time and not having their eyes checked.
Okay.
And it's during that time that the retina, the structure that you're talking about, starts getting sick. We call that diabetic retinopathy, and it comes in stage, we grade it as doctors, from what you call mild to severe. The very severe, very severe is the one that leads to blindness. Quite early, really truly doesn't cause blindness, but it has to be managed appropriately.
Yes.
And what I mean by that is fairly early in the development of diabetic retinopathy, a person needs to get and this is the important part, Dr. Tebz, the person needs to get their diabetes treated properly.
Okay.
Together with high blood pressure, because majority of patients who have got diabetes also have high blood pressure, and they work together to cause problems in the eye and elsewhere in the body, as general practitioners and other doctors would say. So the two of them, if they're not managed properly, this is the important part, they can cause severe damage to not just the eye but to other parts of the body. So if the person has got diabetic retinopathy, but their sugar, and this is early, before they start having huge problems, which you can talk about later, but early, and they are managing their diabetes and their blood pressure properly.
Yes.
And they can prevent this diabetic retinopathy getting to a point where it blinds them.
Okay. So you've mentioned these risk factors, we say, you know, but what other things put a person at risk of having diabetic? You've already mentioned the high blood pressure, the sugar control, but what other things pushes a person into that severe stage
of diabetic retinopathy? The biggest one here, and I must emphasize this, it is the sugar that is not managed properly over time. And when you go to the clinic, or you go see your general practitioner, or you go see your specialist who's managing your diabetes, you almost always need to ask them, is my sugar being managed appropriately? The majority of patients who've got sugar diabetes, or sugar diabetes in general, normally check their sugar at home, and their doctors would have told them where they must keep the sugar levels. The important thing, and this is the important part, is to make sure that your sugar is managed appropriately all the time. Not sometimes you cheat, sometimes you hear of terms like that. And sometimes I cheat, and then I can eat the Coke, drink the Coke with my cake. So don't do that. Manage your sugar appropriately and the blood pressure. But coming back to your question, other things that can cause the problem. So the renal function. So again, this by renal I mean the kidneys.
Yes.
Diabetes can also damage the kidneys, because like I said, it can damage a variety of things in the body, including the kidneys. So the people who've got diabetes and the kidney that is not working properly, we call it nephropathy or kidney failure or kidney dysfunction, they are at a very high risk of developing diabetic retinopathy. People who've got something called anemia, which is, as Dr. Tebz, you know that, but just to viewers at home, is when your blood is not strong. We say, people normally say that you've got low blood. That is the term that is used by people. So anemia can contribute to this problem. And sometimes people, when they're diabetic but go on to be pregnant, which is a very normal phenomenon to be pregnant. So when they go on to be pregnant, their sugar can become a problem, and specifically it can increase the risk of developing diabetic retinopathy in the eye. So we normally say to the patients, if they plan on being pregnant, or if they are pregnant, they must fairly early, in collaboration with their obstetrician, get a physician to manage their sugar properly during their time, because it is during their time that they can start having diabetic retinopathy in the eye. One other risk factor, it is what we call obesity.
That's being chubby.
That is being chubby. Now, it is a problem now because, you know, nowadays we as people find it very difficult to cook at home, but specifically for people with diabetes, it's a big problem because it increases the risk of developing these problems that you're talking about. And just to say that to all of us, we need to be exercising all the time. And by exercise, I don't mean go to the gym and run and be the best person running in that particular gym. A brisk walk, 30-minute walk, if you can do that every single day.
A simple walk.
We spend a lot of time driving nowadays and being in the car, and then we're sitting and do nothing. Walk, if you can do that. Even better, start jogging. And then we can deal with most of our health problems, and specifically diabetes in general. Just to also say to the listeners at home, and I'm sure they would have heard this from other doctors and nurses at the clinic, that if you exercise appropriately and eat appropriately, you can keep sugar diabetes out of your system. So you can delay developing diabetes. I'm not even talking diabetic retinopathy now, I'm talking diabetes in general. That if you exercise appropriately and eat appropriately, you can stay free of diabetes.
Sure.
So we need to do that. We need to exercise and keep ourselves fit as much as possible.
Sure. So from what you're saying is that diabetic retinopathy is literally a preventable, disease. It's literally preventable.
It is.
From just not getting diabetes in the first place.
It is.
And it all revolves around our lifestyle. This is all it is all about.
It is. Diabetes, we normally say that it's divided into two types. There's one type called type 1,
Yes.
which normally is an inherited problem that we don't seem to have control over whether we're going to have it or not.
Yes.
This is having chosen the wrong parents. And then there's type 2.
Yes.
Now, type 2 is something that we generally have total control of whether we're going to develop this or not. And this is to keep healthy.
Yes.
By exercising and eating the right food. And the numbers that you spoke about earlier at the beginning of the show about the predicted numbers of diabetes and diabetic retinopathy over years increasing is largely because of the lifestyle.
Of this lifestyle.
Yeah, that we're just no longer exercising, we're really eating bad food, and that's the problem. That is the
Yes.
problem. If we exercise regularly and try as much as possible to eat the right food, then we can keep diabetes out of our system. So it's a preventable disease, yes.
Okay, so let's say for the patient who has diabetic retinopathy, number one, you made it sound like it's irreversible, this condition. And number two, how do you treat it? Is it treatable if you have it?
Once you've got diabetic retinopathy, like I said earlier, we divide it into stages. So if you start having this certain types of stages, there's two types that will need to be treated appropriately by your treating ophthalmologist or specialist eye doctor.
Yes.
And the one is called diabetic macular edema,
Okay.
which is the medical term, which essentially means that, from what I was saying earlier, that these blood vessels will start leaking into the retina.
Yes.
The retina starts swelling up. And when
Yes.
you look at that picture in your screen, you can see these yellow
spots,
the yellow spots around there.
Yes.
We call that lipid. That is that's leaking from the vessels. And there's a lot of blood as well around the retina there. Those are hemorrhages, we call them.
Yes.
So this, what you call the macula, which is the central part of the eye, that part there, this is where perfect vision comes from. It's when you're looking at me now, you actually are looking at me with your macula. And although you can see him with peripheral vision, to actually be able to tell who this gentleman is, you have to look at him.
That
and
is
then
true.
you're taking your macula, you're putting it on him.
So I can
so
see
you can
exactly.
see him. This is a very important part of the retina. Now, diabetes causes that part to swell up. And that is called diabetic macular edema. And now, over the years, we have really gotten better at managing it or treating it. Because previously we used to just do laser of this, and it really didn't give us a lot of vision back that we would have lost from diabetic macular edema. Now we can deliver injections, special injections, right inside the eye.
Inside the eye.
So that we can treat this problem.
Okay.
And then your vision can come back. So it's a treatable problem. And the second diabetic retinopathy that is treatable but also quite severe is when these veins that I was talking about starts developing what you call new veins.
Yes.
And they bleed very easily. I think
Like
this picture
this
showed
one.
this beautifully. That you can actually see the hemorrhage.
Yes.
And that hemorrhage or the bleeding is coming from these new veins that would have developed as a result of diabetic retinopathy. And they bleed very easily. And unless we sort them out or treat them, this particular patient could end up with big problems of this retina essentially dying or becoming detached over time.
So like in this picture.
Like in this picture. So what then has happened is that diabetic retinopathy here has become so severe that you start seeing these wide bends around, what you call fibrous bends, as a result of a chronic or long-standing diabetic retinopathy that wasn't treated properly. So this problem can lead to blindness, and this is when we really get worried about the patient. But even then, there's stuff surgically or using surgery that we can do to remove some of these bends if they are pulling on the retina and threatening to detach the retina and leading to blindness. So as eye specialists, we are able to go in using an operation to peel off these membranes so that the patient can go back to as much normal retina as is possible.
Okay.
Yeah, so it's treatable. It's
treatable.
Yeah, but first prize in managing diabetic retinopathy is to prevent a person first getting diabetes in the first place. And once you've got diabetes, is to prevent diabetes causing this problem in the eye. And to do that, you need, once you have diabetes, you need to be seen by an eye doctor regularly. In fact, as soon as you are diagnosed with diabetes or you're told by a doctor that you've got diabetes, you need to go see an eye doctor who should check your eye to make sure that you don't have any of these problems. And often your doctor then will tell you that because you don't have any problems in your eye, we'll see you every year, once a year, to just check that there's no problems in the eye. And that sort of checkup of the eye in diabetic people, it is something that they have to do for the rest of their lives. In the same way that you're going to breathe for the rest of your life, you need to have your eye checked for the rest of your life if you've got diabetes. Every year.
Every year.
And if your eye doctor sees problems in the eye, they might tell you that I need to see you more frequent than once a year.
Okay.
But they'll be guided by what the doctor is seeing. But if the doctor sees nothing and you've got diabetes, they will tell you that I'll see you next year again around the same time. You might as well diarize it along the lines of your birthday dates.
True.
So that maybe it's during your birthday month that you need to go then have the eye check done by your eye doctor.
Okay, so in summary for the viewers at home, it sounds like it is that they have to get the eyes checked once a year. And that it is their responsibility to ensure this. Because, I mean, from both of our experience, we have seen patients say, but the doctor never sent me to you. So they actually have to take the initiative to find an eye doctor.
Exactly.
And so where do we find an eye doctor? Where can the viewers find eye doctors who can check their eyes once a year?
To have your eyes checked once a year, you can see what we call a general practitioner, and I think most people are familiar with what we call GPs. Because you find them everywhere. And often these are the people who are treating your diabetes. So these are the people who can check inside your eye. So, and they normally would diarize it. So the GPs are so busy sometimes that perhaps they might forget. Then as a patient, you need to remind them that during 2021, we're approaching end of the year and my eyes have not been checked. So because they trained to check the eyes, GPs, and they'll be able to check the eye. And if they see something that they are uncomfortable with inside the eye that needs treatment by a specialist, then they will refer you to doctors like myself who are specialists in treating diseases of the eye. But the best person to check the eye is a general practitioner who's treating the sugar. Some patients who often wear glasses, they see their optometrist fairly regularly to have their eyes checked. The optometrist can also check inside the eye, looking at the back of the eye to make sure that the retina is still fine. And again, the optometrist, these are the people who check and give out the glasses. The optometrist. So the optometrists then are able to look inside the eye also, and if they see problems at the back of the eye on the retina, they will also refer you to the eye specialist who will manage your diabetic retinopathy appropriately.
Okay, so then your optometrist, your GP, basically the doctor who's taking care of your diabetes.
The doctor who's taking care of diabetes, exactly. In some places, remember that the nurses also, we call them professional nurses, also manage people with diabetes, and particularly in our clinics, where you find that the doctors perhaps come once a week, and the majority of time the sisters are appropriately managing diabetics and people with high blood pressure in these clinics. And it is the same sisters who also are able to look inside the eye with what we call an ophthalmoscope. It's an instrument that they use to look inside the eye, to look at the back of the eye. So they should also check the eye at the back. And if they see any problems, to refer the patient to the eye specialist. But like I said, you know, the problem with being checked once a year, and it's not just for diabetes and the eye, it's for a variety of conditions that the people might need to be checked once a year by people, is that the health practitioner might forget about the patient. It shouldn't happen, but it happens. They should diarise it. But remember that when people start being overloaded with a lot of patients and dealing with a variety of things, they might forget your eye check that particular year. So it remains the responsibility of all of us as patients to remind people who are treating us for diabetes that it's been a year and no one has looked in my eye. Can you please look in my eye or send me to the appropriate person who can look me in the eye?
Yeah, so this is the best example for putting the health back into the hands of the patient, because as you say, the system is overloaded.
The system is, and everywhere. It's not just in state hospitals. In private facilities are also overloaded with patients. And from the numbers that you gave at the beginning of this show, it looks like this problem is not about to end.
Okay. So with that, I mean, you have given us such a beautiful overview of what diabetic retinopathy is, how it's treated, how it should be prevented, who should be checking the eyes, and so forth. What is your parting message for our viewers at home who are now listening and saying, I'm gobsmacked at all of this? What is your parting message to them that they must remember, the take-home message?
Two messages.
Yes.
The first one, and perhaps the most important, is that we need to get out of there and exercise. Try as much as possible to eat the right food. And the second message is that if you have diabetes already, you need to have your eyes checked at least once a year. It'll keep your vision going for the rest of your life.
Yes.
If you did that.
Yes. No, thank you very much, Dr. Makgotloe. Thank you so much for joining me on this episode. This was a very insightful conversation about diabetic retinopathy, and I know that our viewers at home have learned so much, and I'm sure they have realized the importance of owning their health, especially as diabetics. And to our viewers at home, I want to say thank you so much for joining us on this episode. Thank you, and I hope that you have learned and you're making new decisions to exercise, and as diabetics, to check your eyes once a year. So if you have any questions, please do find us on any of our social platforms, and please do post your questions there. But until next time, take care of each other, stay safe, and remember, your health is in your hands. God bless.